Hello, it's Bill, the knee pain guru, and welcome to the Ask Dr. Beck show. Welcome, Dr. Beck.
Good morning, everyone.
Today's Friday, February 11th. So this week, due to changing of schedules, we're going to be doing the Ask Dr. Beck show today moving forward on Fridays at 8:30 a.m.
Until further notice.
Until for notification, until that might change.
Yes, indeed.
Let's see. Yeah, so we have some questions that came in for those that are watching live. Let's see. Let me get there it is. Ask Dr. Beck. If you have a question about pain, about medical stuff, you can go to the ComellaFoundation.org/ask Dr. Beck.
We are less accurate with winning lottery numbers, but we are happy to give you our opinion.
Yeah, we are. Okay. So you were saying right before we went live, you had another delay, no windows in your place.
Yeah,
Still
yes.
on stuff.
Oh, yes. I scratch my head at how the world has changed since we were young.
I scratch my head at how the world has changed since last week.
Well, that's true as well. I remember one of my first jobs, I was doing computer software, and we would go into companies and basically organize their data and then write report templates so that they could get things done. And we told them we'd be done by a certain time. And you moved heaven and earth to get that to happen. You know, you worked until 3 a.m., you went to sleep for 3 hours, and you came back and you put another day. And I'm surprised at how the world has changed, because people's words don't seem to mean much anymore.
Well, I agree.
Yeah.
And I think there definitely is generation to generation. There is a different understanding of what words mean.
Yes, indeed. Yes, indeed.
Okay. Well, let's dig into questions. Let's see. This question is from Conor. Conor is having keyhole surgery on the 16th of February. So that is in 5 days for his ACL. I was wondering if there's a chance I could be awake for the surgery, as I don't like the thought of being put asleep. I believe I've only torn my ACL, but it's been 4 years since my injury. Seems like that's a long period of time between diagnosis and surgery.
Well, I mean, you can live with a torn ACL if you're not a pro soccer player, and you're probably not going to really tweak it much.
Right.
But his question is, can he be awake?
Yeah, I'm thinking like local anesthetic or a nerve block kind of deal where they would numb.
Yeah, and no.
Okay. Well,
that's the answer. No. I'm going to add a lot more words to it, because we have to understand why being awake for something like a knee surgery would not be a good idea. So let's just go with the simple thing. If all I was doing was putting stitches in the knee for, I don't know, something that penetrated it, right? You stuck a big rose thorn in there, that we can do a local. And if I tell you to stay still, you pretty much won't move. So the problem when we get to doing surgery inside the knee is that we need to be very precise with what we're doing, or at least as precise as we can be. We're going to go in, we're going to take out the old ACL, and then basically we're taking a cadaveric, a dead person's ACL that's been cleaned so our body doesn't have an adverse reaction to it. And then for all intents and purposes, we take drywall screws and we put it in. Okay. The problem is that during that surgery, if you were to move, potentially catastrophic results, certainly less than optimal results. So the biggest thing that needs to happen is that we can't let you move.
Mm.
And even if we give you a nerve block, there's still the potential for movement.
Mm-hmm.
So that's why you have to be out.
Mm-hmm.
Now, it's potential that you could record the surgery if you wanted to see what was going on.
Mm-hmm.
Surgeons may let that happen.
Mm-hmm. I had a question, and you gave an example of using a cadaver ligament
Yes.
as a replacement ACL, but they also do the patella replacements and do hamstring grafts.
Yes.
And that would seem like it would even be riskier with.
But effectively, you have then two surgeries going on at the same time.
Right.
Yes.
So that would make it more difficult. And Conor wasn't specific as to the type of
Yep.
ACL replacement he was having.
And then potentially, if you have those multiple surgeries again going on at the same time, not only more risk for infection because I'm opening the body in a couple of different places, but more risk for scar tissue buildup.
Mm. Okay. That wasn't really a question. It was more of a statement that came in.
Yes.
Okay. Let me see what we could do here. We want to hide that because that brings no value. Okay. Well, that was a pretty simple, straightforward.
Yeah.
I have an interesting question for you, and this
Okay.
has been one of the things in Systema that we do is actually walk on the physical body. You know, we walk up and down the legs, face up, face down.
Sure.
And one of the patterns that I've noticed with the guy that I've been training with is exceptional tightness between the elbow and a third up the arm.
Got it.
And the same same place between the knee and a third up the femur. So it seems to be a pattern going on because it's all both femurs, both humeruses.
Yep.
So you have this gap that's, or this length that's 6-8 inches from the elbow up the bone that is incredibly tight, incredibly painful. And it seems to be a pattern.
Same side, top and bottom, or alternating sides?
It would be on the inside, the medial part of the bone.
Yeah, but like left arm, right leg, or left arm, left leg.
Right arm, right, all four. And it's with the guy I'm training with as well.
Sure.
Same areas that it's like, whoa, that really hurts.
Yep. Okay, so here's the way my brain broke down what you said. When you point to that area, the first thing I'm thinking is that are there muscles that attach, for example, there, that don't really attach other places? And I could bend the rules and say yes, but for the most part, it's a no. There's nothing that would be pulling on that area abnormally.
Mm-hmm.
You said hard, right? You're trying to effectively walk on it or put a lot of pressure into it and get it to be compliant.
Okay.
And it's resisting you. Okay.
Correct.
And so what I think then is osseous strain in the bone. So our bone is made up of collagen, the stretchy stuff in our skin, and then a mineral complex of which calcium is a large part.
Mm-hmm.
The mineral complex is hard. The collagen is kind of soft and squishy.
Right.
So living healthy bone should be, in my mind, I think of it like pushing on drywall where there's not a stud. The drywall is going to give, and it might only give 0.5 millimeter, but there's some give to it. And that's very different than pushing on concrete or steel, which doesn't give.
Right.
So I'm hearing that this bone doesn't give. So my brain goes to osseous strain.
Okay.
Where you happen to be talking about is where the growth plates were in this person when they were growing up. and you can get a growth plate restriction from falls, jumps, whatever. Basically, the end of the bone jams into the shaft of the bone, and until it gets taken care of, it's still there, even if you're an adult and those growth plates have fused.
Mm-hmm.
That's what I'm hearing.
Okay.
And then from an osteopathic standpoint, what I would do is take one of those, one of the four, doesn't matter which one you start with,
Right.
grab above and below,
Mm-hmm.
press and balance. So I'm going to take the end of the bone, the shaft of the bone,
Mm-hmm.
balance them in 3 dimensions as much as I can, compress them, and allow it to unwind, and hopefully then expand. If the tissue after you do that gets soft, you have not only your diagnosis, but your answer for treatment. You just need to treat the other 3.
Got it. Okay. Cool. Yeah, that was interesting. I was and there's a lot of dynamics that are going into this because I do both direct and indirect work on myself, and one of the things that we were working on or have been working on is the Pravilo, which is the Russian. So this is in traction. It's direct. It's just a direct technique in traction.
Yeah.
So anyhow, it's just trying to wrap my brain around what it might be and why it was so challenging.
Yeah. Yeah. That's the first thing that came to my mind.
Oh, cool. Excellent. Well, thank you. I will work with that and see what shifts, and I'll report in next week to let you know how that is.
Very good.
Okay, well, let's play our little promo thing. We'll play this and we'll be right back and probably wrap it up, unless there's some people here watching and they have some questions they want to type in. Our mission at the Comella Foundation is to relieve pain naturally using osteopathic healing principles. The Comella Foundation is recognized as a nonprofit 501c3 under the Internal Revenue Code. Your contributions are greatly appreciated. Please consider taking a moment and donating to the Comella Foundation to help us continue our important pain-relieving work. Every little bit helps. And we're back. Okay. Anything else you want to bring in? Anything you want to expand on what was last week we talked about, the refrigerator, electronic EMFs that expand from there?
There's other things, but not necessarily related to last week. So things are beginning to congeal in my mind.
Okay.
About the events that are going on and transpiring in the world.
Okay.
Specifically as to how I see them show up in my practice.
Okay.
So got to lay the foundation first before we go into what I'm seeing and why I'm coming to the conclusions that I'm coming to.
Mm-hmm.
If somehow I were able to secretly teleport, keeping my face on the camera, and I were able to sneak up behind you and touch you at the same time I'm saying boo. Okay. In theory, it startles you. Your response, typically as a human being to getting startled, your nervous system kind of jumps for a moment and you gasp and take a breath in. Mm-hmm. Okay. And that's typically what happens.
Yes.
If that in-breath gets stuck, we would call that osteopathically shock.
Okay.
And the diaphragm effectively has gone into spasm, your big breathing muscle that sits at the bottom of your rib cage. Mm-hmm. Prior to this global whatever in the world is going on, I would see that, sometimes, but not very often. And it was easy for me to then talk with that person and say, hey, this is what I'm finding. What do you think happened? Is there something in your life that did startle you? Mm-hmm. And it might have been, a couple of months ago, my kids they jumped up on in the bed and jumped on me. And it was all that stuff. There was a reason. Well, that pattern then shows up as tension in the back where the rib cage ends. So this is where the low back and the rib cage come together.
Mhm.
And since the pandemic, I have been seeing it regularly, probably in more than 50% of the folks that walk through my door.
Wow.
Okay. And this is a lot of times, even after I've treated it once or twice, it's still there.
Mhm.
And, you know, I just kind of put it down to it's COVID. It is, whatever. This morning, my brain worked on, oh, it's fear. Literally. I mean, regardless of what's going on, regardless of the validity of the science or whatever, what we've been doing for the last almost 2 years is propagating fear. And it rests in people in big ways or small ways. Today, what I've recognized is, oh, that's what I'm seeing walk through the door. That the response in the patient's body is the same as gasping.
Mm.
The sky is falling. And then all of a sudden you can't breathe. Now, it slightly changes the way that I treat people, but nonetheless, what you're trying to do from my standpoint as an osteopath is to get that respiratory diaphragm moving freely again to restore breathing.
Mhm.
And then that restores the ability to think.
Mm.
Because again, what happens, and we see this in military and martial arts training, is that when you are in pain, you stop breathing.
Mhm.
By stopping breathing, you can't think and you can't work your way out of the pain.
Right.
So what you try to do is, no matter what kind of pain you're in, breathe and breathe at a controlled rate so that you can focus on your breathing and still think and get your way out of a situation.
Mhm.
By restoring the breath in these people, we allow them to start thinking again.
Mhm. I like it.
Yeah.
It's an interesting piece on breath that from my martial arts training that was different, at least I saw, is many times there's this idea that when you're in physical pain or fear or whatever it is, we want to relax our breath. Long, slow, smooth, deep breaths. But what ends up happening is there's not enough oxygen and the
Yep.
person can pass out in that
Yep.
place. So the breathing, at least how I was taught in Systema, was you make the breath shorter and sharper. Sharper inhale, sharper exhale, and faster.
Yep.
So it's like a car driving up a mountain, how you have to downshift to keep the RPMs of the vehicle up in order
Yeah.
to maintain
Yes.
the engine so the engine doesn't stall. Same thing.
Yep.
The more fear, the more tension, the more pain you're in, the faster you need to breathe in a way that allows to move the nervous system into a parasympathetic state and allow you to keep moving
Yeah.
forward.
Yeah. Cool.
Yeah, I love it. That's good stuff.
So
Cool.
now I can add just a little bit more on what we talked about last week with electromagnetic frequencies.
Yes.
So when I was in undergrad in college, majored in electrical engineering, took courses in sound and acoustics because what I really wanted to do was be an audio engineer.
Mhm.
That didn't pan out, but still the knowledge is there.
Right.
And what you learn is that when you take a piece of wire, doesn't matter what the wire is made of, but conductive wire, and you cut the wire to a length, there is a formula for which that length will be an antenna at a certain frequency.
Mm-hmm.
Okay. So, for example, if you take a twist tie off of a loaf of bread, that twist tie, by definition, is an antenna of a certain frequency because it's a piece of wire and it has a certain length.
Mm-hmm.
Okay. Same thing happens when you put wiring in a house. I'm going to start off with a spool of wire. It doesn't matter how long it is. I'm going to start cutting that wire to run from the electrical service panel box to whatever outlet or light switch or whatever I'm powering.
Mm-hmm.
There are going to be multiple wires in the house. all of which are then passive antennas, right? They all pick up a certain frequency. The moment I put electricity through them, kind of by definition, they become amplified antennas.
Mm-hmm.
And those antennas then can pick up frequencies that are detrimental to you and I. Okay. From my reading, first person or first team to figure that out was Graham and Stetzer. They came up with this Graham-Stetzer frequency and theory, and then they developed a Graham-Stetzer filter and a testing device. Basically, you plug it into the wall. It gives you a numeric readout in Graham-Stetzer units, and it amplifies what's going on through the wiring from the service panel to that outlet that you plug into.
Mm-hmm.
And so as I was doing my research on this, I'm like, oh, that seems really cool. I think I'll get one. And I remember plugging it into an outlet in the house and hearing an AM radio station. Literally coming through the wiring of the house.
Wow.
And I thought, oh, that's cool. I'll go to the next outlet. Nope, that next outlet was a different length. So not the same frequency. And so it's something that, first of all, not taught in electrical engineering training at all.
Mm-hmm.
Had to learn that after the fact. And then what you recognize is that when you, for example, sleep on a bed, if it is a traditional designed inner spring mattress, they take lengths of wire, turn the machine into a coil.
Wow.
And you happen to be sleeping on a lot of antennas.
Uh-huh.
Okay. And there's research out there that suggests that those antennas might increase your risk of cancer.
Mm-hmm.
I'm not sure how much weight I put into that. Conceptually, it makes sense. I'm not sure how it plays out in the real world.
Mm-hmm.
But nonetheless, would make sense if you're going to buy a different bed to get one without inner springs.
Right.
Just on the off chance that could be true.
Sure.
And we've been very happy ourselves with latex mattresses,
mm-hmm.
Which is a different topic for a different day.
Sure.
But those filters that you can use to take out those Graham-Stetzer numbers to take away the radio frequencies are made by Graham-Stetzer and also a company called Greenwave.
Mm-hmm.
And research is available on their websites, and want to say that you can get the devices both from the websites and from someplace like the world's largest online retailer.
Okay. I just brought up this Graham-Stetzer filter. Microsurge meter.
Yep.
Okay. And it's a way of determining where
the tester, which has a little speaker built into it and a digital display, you plug it into an outlet to find out if that particular wiring is causing a problem.
Mm-hmm.
Okay. If the numbers are super low, you don't need to do anything. If the numbers are super high, you plug in a filter, and then you can test the other outlet on that duplex receptacle, and you'll see that the numbers come down. Uh-huh. They make filters with an outlet in them, so you plug into one of the side of the duplex outlet, and you have another outlet, so you don't lose anything.
Right.
And they make them also without. And I want to say when I bought mine, this has been probably 6 or 8 years ago, but it was like a home kit. Came with, X number of these and Y number of those. And it was the basics for taking care of your average home.
Mm-hmm. Got it. And it's a way of reducing the EMF exposure inside your own home? Is that
Yes, sir.
Oh, cool.
Yes, sir. And then if we put together most current electrical code would be an outlet roughly every 6 feet of linear wall space.
Mm-hmm.
Your Twin bed, for example, is going to be about 3 feet wide. Your queen bed is going to be almost 5 feet wide, and a king bed is 6 feet wide, which basically means a king bed is either going to sit squarely over an outlet or it's just barely going to bracket 2 outlets.
Got it.
If those outlets are throwing off radio frequency waves that then can be picked up by the inner spring mattress, we have a combination of effects where you just happen to be laying on an active antenna.
Ay.
Yeah.
Okay, I get it. I'm gonna look up that. I'll throw the link to more information in the description box below.
Cool.
For people to check it out. Well, cool. Well, thank you, sir.
Absolutely.
Well, anything else you want to share? Otherwise, we'll wrap it up.
I think that's it for today.
Awesome. Well, we'll be back next Friday,
8:30
a.m. Let's see. This is Bill Paravano, the knee pain guru, on behalf of the Ask Dr. Beck show. Thank you all for being here. Have a wonderful day, and we will see you on the next one.
Take care, everyone.